When assessing the patient to see if an SI belt or a Preggie-SI belt will help the patient, as a physio or the clinician, you can perform the active straight leg raise test, which is a validated test that assesses the ability of the belt to assist with force closure across the lumbar pelvic area and will directly tell you if this patient will benefit from a belt or not. Ask the patient to alternately lift their leg in the air. Good to me. Look for compensation strategies such as breath holding, bulging of the tummy, bracing or pushing down with the arms. To me, which leg feels heavier to lift for you?
The left one feels heavier to lift.
Good. So now the physio will come in and act as a vector to reproduce the different stabilizing muscles. So now Nikki is going to approximate the ASISs, the anterior superior iliac spines, to provide a vector as done by transversus abdominis. Lift alternate legs to me. And does that make a difference to me? Good. Now Nikki is going to be the vector of pubococcygeus by approximating the pubic symphysis. So her thumbs are in the femoral triangles and she's medially rotating the hips and holding that position, and the patient then alternately lifts the legs again up to 30 or so centimeters. How does that feel to me? Good. And lastly, the physio will put their hands behind the patient onto the PSISs, the posterior superior iliac spines, and approximate. You can see Nikki's elbows are in opposition to each other, and then while you hold that, activating multifidus, the patient then alternately lifts the legs. And how does that feel to me? Good. And that's what you want to know that the belt is appropriate. You need to see a strongly positive test, and you'll therefore know that TUMI will benefit from the use, in this instance, of a Groovi SI-Preggie belt.